All right, everybody. Good morning. It's Dr. Rafit from Vet Triage. It is Saturday, November 30th, 8:23 a.m. Pacific time. We are going through the last bit of this veterinary surgery journal from 2015, and we're talking about this study, radiographic CT and arthroscopic findings in labs with medial coronoid disease. This comes out of the Netherlands. The objective is to describe the X-rays, CT, and scoping in different age groups of Labradors diagnosed with medial coronoid disease, and to compare ulnar subtrochlear sclerosis seen on X-rays with the ratio between the mean attenuation of the ulnar subtrochlear bone and the mean attenuation of the cortical bone measured on CT. Prospective study, 31 dogs, 31 elbows, and then 6 healthy dogs, 6 elbows. These are between 2008 2012. Results: ulnar sclerosis was found in 87.6%, and the most common finding on X-rays for dogs that are 1 year or less of age. Blurring of the cranial edge of the medial coronoid process was seen in 66.7%, being the most common X-ray finding in dogs over 12 months of age. Medial coronoid process fragmentation was the most common CAT scan finding in both groups, 93.8% for dogs for 12 months of age or less, 66.7% over 12 months of age. A displaced fragment was found in 68.8%. That was the most common scoping finding in dogs that were 12 months of age or younger. Whereas chondromalacia, 53.3%, was found in dogs over 12 months of age. Sensitivity of X-rays in detecting medial coronoid disease was 93.8% for dogs that are 12 months of age or less, and 73.3% over 12 months of age. For CT, the sensitivity was 93.8% for dogs 12 months of age or less, and 66.7% for over 12 months of age. X-rays evaluating ulnar sclerosis was strongly correlated with CT findings of ulnar sclerosis. Okay, introduction. Prevalence of medial coronoid disease is 11 to 50% in labs with forelimb lameness and 6% in a screened cohort of Dutch Labrador retrievers. Despite its variable sensitivity, ranging from 10 to 62%, radiographs are usually the first line of defense, and they look for secondary DJD, such as periarticular osteophytosis at specific joint locations, ulnar subtrochlear sclerosis, blunting or blurring of the cranial edge of the medial coronoid process, and uncommonly find the primary lesion. Medial coronoid fragmentation, medial compartment erosion of the humeral trochlea in the cases of osteochondritis dissecans-like lesions, and presence of radio-ulnar incongruity can also be seen. Another study showed that the most common CT finding was an abnormal shape of the medial coronoid process at 97% incidence, sclerosis of the medial coronoid process 95%, and then followed by irregularity of the radial incisures 83%, osteophytosis 74%, medial coronoid fragmentation 28%, fissures 27%, humeral trochlear subchondral lucency 16%. Scoping in 263 dogs identified fragmentation as most common finding, 64.1%, followed by contact lesions of the humeral condyle at 49%, and then finally cartilage fissures at 18.3%. Scoping is reportedly of greater diagnostic value than X-rays and CT when you look at experimentally induced radial ulnar incongruity. Materials and methods for radiographs. They did 4 projections: craniocaudal, craniolateral, caudal medial oblique, 90-degree flex medial lateral, and extended 15-degree supinated medial lateral. They worked with the International Elbow Working Group guidelines for grading. Grade 0 was elbows without evidence of a primary lesion, osteophytosis, and sclerosis. Grade 1, elbows had less than 2 millimeters size, osteophytosis, and or the presence of ulnar subtrochlear sclerosis and or blunting or blurring of the cranial edge of the medial coronoid process. Grade 2, elbows had osteophytosis at 2 to 5 millimeters in size and or obvious sclerosis in combination with suspected primary lesion of radio-ulnar incongruity, ununited ankylosing process, medial coronoid process fragmentation, and osteodessecans-like lesion. And then grade 3, elbows with osteophytosis that were over 5 millimeters and or obvious primary lesions such as radio-ulnar incongruity, ununited ancanal process, fragmentation of the process, or OCD-like lesions. Ulnar subtrochlear sclerosis is characterized by the loss of trabecular bone architecture and increased density. Negative, mild, or obvious were the grades used. For blunting and blurring of the cranial edge of the medial coronoid process, they characterize that by a loss of clearly defined edge of medial coronoid process on medial lateral and extended supinated medial lateral views. CT assessment. They were looking for periarticular osteophytosis, abnormal contour and structure of the medial coronoid process, cyst-like lesion of the radial incisure of the ulnar and humeral trochlea, irregularity of the radial incisure of the ulna, evidence of other primary lesions such as fragmentation, radio-ulnar incongruity, and OCD-like lesions. Joints were considered congruent if there was an absence of a step defect between proximal radius and ulna and the sagittal plane. Scoping assessment, they used the modified outer bridge score. And for those who watched yesterday's live stream, went over that. The score of 0 means normal cartilage. 1 is chondromalacia. 2 is partial thickness, fibrillation, and fissuring. 3 is full thickness fissuring. And 4 is full thickness cartilage erosion with exposure of subchondral bone. Coronoid dysplasia characterized by osteomalacia and chondromalacia, fragmentation with a fragment in situ or displaced fragments, synovitis, and radio-ulnar incongruity were all looked out for on the scoping. And then synovitis was also graded based on the appearance of synovium with erythematous discoloration of the synovial membrane, and in more severe cases, large number of villous protrusions. And so this is a picture of a scoping. In case you never saw, that silver thing is a probe, and they're pushing on the cartilage, and you can see in picture A, there's no indentation where that star is. Then B, they push down, and C, you can see indentation there where the star was. Results: 51.6% of dogs were 12 months or less. All dogs had a history of lameness. Crepitus, joint effusion was detected on physical exam. Pain on joint flexion extension. Dogs 12 months or less. Mostly were male, mostly intact. Weight was 30 kilograms. Duration of lameness 2.4 months. Dogs that were over 12 months of age, most were male intact, but they were tied with female intact. Mean weight 34 kilograms, duration of signs 5.9 months. So much longer duration of signs for older dogs. That might be because we tend to blame older dogs on being like arthritic or whatever, other diseases. Whereas with younger dogs who are lame, people tend to take them in pretty quickly for diagnosis. And the differential diagnosis list for younger dogs with elbow pain especially is much less in number than older dogs. Control dogs, mean age 6.5 months, weight 27 kilograms. X-ray findings: 12 months of age or less, 6.2% were graded as elbow dysplasia grade 0, 6.2% is grade 1, mostly grade 2, 75%, and then 12.5% for grade 3. Ulnar sclerosis was the most common radiographic finding, 87.6%. 37.6% of those dogs had mild, 50% had obvious. Blunting or blurring of the cranial edge was seen in 75% of joints. 56% of joints had periarticular osteophytosis, with the most common site being the medial edge of the medial coronoid process, followed by proximal surface of the ancanal process. And then fragmentation of the process was 6.2%, and 75% were considered suspicious of fragmentation. OCD-like lesion was seen in 18.8% of joints on the humeral trochlea, and 12.6% had radio-ulnar incongruity. And now in dogs over 12 months of age, 26.7% were elbow dysplasia grade 0, 26.7% were grade 1, most of them were 33.3% was grade 2, and then 13% grade 3. Blunting or blurring was the most common X-ray finding in 66.7%, followed by different degrees of ulnar sclerosis at 53.3%. And then of those, 40% was interpreted as mild, 13% obvious. 40% of elbow joints had periarticular osteophytosis, with the most common site being the medial edge of the medial coronoid process, followed by the cranial edge of the radial head. Obvious fragmentation was detected radiographically in 6.7% of joints, and 40% was considered suspicious. Radial ulnar incongruity, 13.3%. Finally, the sensitivity of radiographs for detecting medial coronoid disease was 93.8% in dogs 12 months or less, 73% in older dogs. Radiographs showing more severe ulnar sclerosis was identified in 12 months of age or less. Now, CAT scan findings. In CAT scan findings, dogs that were 12 months or less had obvious fragmentation in 93.8% of elbows, osteophytosis 75%, with 31% being grade 1, 31% grade 2, grade 3, 12.5%. And then 56.2% were considered to have sclerosis of the medial coronoid process. Cyst-like lesions were found on the radial incisure of the elbow, of the ulnar and humeral trochlea, rather, in 56.2% of elbow joints. An OCD-like lesion was detected on the humeral trochlea in 50% of joints, and radial ulnar incongruity detected in 18.8% of joints. Changes in the medial coronoid process contour and structure was found in 6.2%. In dogs over 12 months of age, obvious fragmentation was identified in 66.7%, and 6.7% were suspicious. Osteophytosis was detected in 60% of joints, 33% grade 1, 20% grade 2, 6.7% grade 3. Cyst-like lesions of the radial incisure of the ulna and humeral trochlea, 26.7%. OCD-like lesions of the humeral trochlea, 26.7%. Changes in the medial coronoid process contour, 20%. The sensitivity of CT detecting medial coronoid disease was 93.8% in dogs 12 months or less, and in older dogs, 66.7%. That was based on the evidence of medial coronoid fragmentation. More severe sclerosis of the process on CT was found in 12 months or less of age. When you combine CT and X-rays, sensitivity is 100% for dogs 12 months of age or less and 80% for over 12 months. Scoping findings in dogs 12 months or less showed a displaced fragment in 68.8% of elbow joints, fragment in situ in 18.8%, and osteochondromalacia in 12.5%. The median outer bridge score was 2 for the medial coronoid process and 4 for the humeral trochlea. 12.5% of joints were diagnosed having radial ulnar incongruity during scoping. 12 months or older showed 53.3% were found to have osteochondromalacia at scoping. 40% had a displaced fragment, 6.7% a fragment in situ, and the median outer bridge score of the process was 1, and humeral trochlea was 4. There was a higher incidence of displaced fragments found in dogs that were 12 months of age or less. Statistically, the ratio between the mean attenuation of the ulnar subtrochlear bone and cortical bone were strongly correlated with ulnar sclerosis on reconstructed CT images. Discussion. The most common X-ray finding in dogs 12 months or less was ulnar sclerosis at 87.6%, and they were more severe than dogs that were older. Changes in the cranial aspect of the medial coronoid process was 66.7%, which is the most common finding in older dogs. The highest incidence of osteophytosis was according to the elbow working group, and the sensitivity of X-rays in detecting disease in less than 12 months was 93.3% and 73.3% over 12 months of age, which is more than previously reported at 16 to 62%. The most common CT finding was fragmentation. 12 months or less was 93.8%, and over 12 months was 66%. Previously reported CT findings where sclerosis of the process was found was 85%, and humeral trochlea 77%, followed by fragmentation at 44%. Another study also reported a high incidence of sclerosis of the process at 83%. Scoping. With scoping, fragmentation of the process was 68.8%. That's the most common finding in dogs over 12 months or less. And then osteochondromalacia, 53% in older dogs. We must conclude that medial coronoid disease can occur without there being relevant X-ray or CT findings, so therefore a physical exam and history are mandatory. Combination of both X-ray and CT found 100% and 80% in dogs 12 months or less and over 12 months respectively. It is obviously higher than based on just X-rays alone or CT alone. It is thought to occur most likely as a result of superimposition of periarticular osteophytosis and increase in subchondral bone mineral density. On CT scan, sclerosis was mainly detected at the medial coronoid process. Finally, ulnar sclerosis is the most common sign in dogs 12 months or less. This further highlights the importance of investigating ulnar sclerosis, especially at the intramedullary bone cavity at the ulnar subtrochlear notch. The marked incidence of cartilage lesions in dogs older than 12 months of age, which are radiographically and CT silent, require more sensitive diagnostic methodologies to identify those lesions. There we go. That's another elbow study, very complex and pretty good. We'll see you guys again tomorrow for another one. Thanks so much for being a part of this. Thanks for the hearts. I appreciate that. It's good to see some audience members here. We've been seeing more views for the playback, those in the playback. So it's great, whether it has to do with just more people knowing about it or whether it has to do with the very cool thumbnails I make. It's hard to say. But thanks for watching. Thank you for the hearts. We'll see you guys tomorrow. Thanks.